Hey everyone, and welcome. Today we're diving into something that's all about getting ahead of the curve when it comes to men's health. We're talking about a specific blood test called the Male Cancer Marker Panel, and it's designed to catch the earliest signs of some really serious cancers.
So here's how we're going to break it all down. First, we'll look at why just waiting for symptoms to show up isn't always the best game plan. Then we'll get into the pretty cool science of how your body can actually send out early warning signals. We'll pop the hood on the 5 specific markers this panel looks for, talk about who should maybe consider this kind of screening, and then wrap it all up with why acting early can make a world of difference.
All right, so let's just start with the big why. Why does a test like this even need to exist? Well, it really comes down to the sneaky way that some of the most serious cancers can develop.
Just think about that for a second. I mean, what if you could get a heads up from your own body, a little warning light on the dashboard, long before you actually felt anything was wrong? This idea is really at the core of proactive health.
And here's the tough reality. When we're talking about cancers like prostate, liver, or pancreatic, waiting until you feel sick often means that the cancer has already had a significant head start. By the time the symptoms are obvious, treatment can be a whole lot tougher.
So if symptoms can be late to the party, what else can we look for? This is where the science gets really interesting. It turns out our bodies can actually produce their own early warning signals.
The key to this whole early warning system is something called a tumor marker. Now, these aren't the cancer cells themselves. Instead, they're specific substances, usually proteins, that can be measured right in your blood. And they're made either by the tumor itself or, get this, by your body reacting to the tumor.
And here's the perfect way to think about it. An elevated tumor marker is basically like spotting a little wisp of smoke off in the distance. Now, does it automatically mean there's a raging forest fire? Not always. There could be other reasons for it. But you'd be crazy not to go check it out, right? It's a clear signal that something needs a closer look.
But here's a really important detail. These markers aren't a perfect one-to-one signal. Sometimes a totally benign condition, like just some inflammation, can make them go up. That's why a single high reading isn't a diagnosis. What doctors are really looking for is a pattern. Markers that stay high, or even keep rising over time. That's a much stronger sign that something's up.
Okay, so we get the idea of what a tumor marker is. Now let's get specific. What exactly is this 5-marker panel actually looking for in your blood?
Well, this panel really casts a wide net by measuring 5 different things. You've got AFP, which can be a flag for potential liver or testicular cancer. There's CA 19.9, which points towards pancreatic and other GI cancers. CEA is a bit broader. It can signal issues in the colorectal area or even the lungs. PSA is the famous one. That's the one most guys have heard of for prostate health. And finally, HCG, which interestingly can be a marker for certain testicular cancers in men.
Okay, so this brings us to the most practical question of all. Who should actually be thinking about a test like this?
This is the big one, isn't it? Is this something you should be adding to your radar? Well, the source material gives us some pretty clear things to think about. So, generally speaking, this kind of proactive screening is something to consider for men over 40. But, age is just one piece of the puzzle. A family history of cancer is a huge factor. Certain lifestyle choices also play a role. And of course, if you're experiencing symptoms that just won't go away and you can't explain them, that is a definite sign to talk to your doctor about screening.
And speaking of symptoms, let's be crystal clear about this. This test is for screening, not for diagnosis. But if you're experiencing any of these things, like sudden weight loss, ongoing stomach issues, weird changes when you urinate, or any testicular abnormalities, those are red flags that absolutely need a doctor's attention on their own.
So, let's bring this all home. We've talked about the problem, the science, and who this is for. But what's the ultimate benefit? Well, it's the incredible power that comes with just knowing. Knowing what's going on inside your own body. And this number says it all. Knowing early is everything. Take prostate cancer, for instance. When it's caught while it's still localized, just in the prostate, the 5-year survival rate is over 90%. That's huge. Getting that information early just gives you so many more options and dramatically improves your odds.
I mean, just look at the 2 paths here. They couldn't be more different. On one side, early detection gives you choices, better outcomes, and a feeling of control. On the other side, a delayed diagnosis can mean you're dealing with advanced stage disease, the risk of it spreading, and just a much tougher fight.
And the best news is that getting this information is incredibly simple. It's just a blood draw.
The only key thing to remember, as the source material points out, is for that PSA part of the test, it's a good idea to avoid any really vigorous exercise or ejaculation for a day or two beforehand, just to make sure you get the most accurate result possible.
At the end of the day, this quote really sums it all up. This isn't about creating fear. It's about empowerment. It's about giving yourself the knowledge and the power to be proactive and to take control of your own health journey.
And with that, we'll leave you with just one final thought to chew on. Whether it's scheduling that checkup you've been putting off or just learning more about your family's health history, what is one proactive step you can take for your health starting today? Thanks for watching.